Hi, my name is Jeng and my team and I have conducted a research and we are from Taylor's University. The title of our research is The Relationship Between Physical Activity and Anxiety and Depression Among Undergraduate Students in Malaysia during the COVID-19 pandemic in Malaysia. And today we are going to present this research. So the Movement Control Order, MCO, which is the lockdown, was implemented in Malaysia due to the COVID-19 outbreak in early March 2020. And at that time, all educational programs were conducted online, including tertiary educations, such as diploma, undergraduate degree, as well as postgraduate programs. At that time also, there was a study conducted in Malaysia whereby they found that there was a high risk of depression and anxiety among the undergraduate students. It was reported that 20.4% of them displayed minimal to moderate anxiety level, 6.6% of them displayed severe anxiety level, and 2.8% displayed extremely severe anxiety level. All this was attributed to the lockdown as well as the quarantine that was implemented at that time. Therefore, there was a lot of studies that has tried to improve the mental health condition among undergraduate students. One of the techniques that was studied was physical exercise. So, why physical exercise? According to the cognitive behavioral therapy, which is one of the therapy used to improve the condition of depression and anxiety, this CBT technique has a component of behavior activation. And in this behavior activation, it is basically to do something about their condition, and part of it could be the physical exercises. So physical exercises can help in improving their emotions and therefore reducing depression and anxiety. So the benefits could be lack of physical inactivity that would increase risk of developing mental disorders. Therefore, improving physical activity would help to reduce the risk of developing mental disorders such as depression and anxiety. It is also a very viable tool to be used in a quarantine area, and it may range from running around, jogging, or it can be some simple stretches which can be done in a very small area. It is also in line with the CBT model, which is the behavior component. Therefore, it is quite research evidence-based. In a sense, this model has been used to improve depression and anxiety for a long time already, and there was a lot of effectivity in terms of improving the mental health condition. This is one of the components. So there are many mechanisms of physical activity in improving mental health, and we are looking at two different types of mechanism. One is the biological mechanism, and the other one is the psychological mechanism. So for the biological mechanism, there are many outcomes as well. It is able to minimize depression-like behaviors related to inflammatory responses, which is the IL-10 reduction in hippocampus pro-inflammatory myokines. It can decrease level of serum thiobarbituric acid reactive substances, in short TBARS, which is an indicator of oxidative stress. As for psychological, it has been found to be able to improve self-esteem and self-concept, which is very related to depression, how they see themselves, as well as improving self-efficacy. The more they conduct physical activity, the more they feel that they are efficient in terms of managing themselves and therefore improving their self-concept and self-esteem. So in this study, the conceptual framework is that the predictor is physical activity, and the criterion is depression and depression symptoms and anxiety symptoms. So we will find whether this physical activity will be able to alleviate depression symptoms and anxiety symptoms. This is the objective of the study: to examine the relationship between physical activity and the level of anxiety and depressive symptoms among undergraduate students in Malaysia during the COVID-19 pandemic. And the hypothesis is there is a relationship between physical activity and the level of depression symptoms, as well as anxiety symptoms among undergraduate students in Malaysia during the COVID-19 pandemic. So this is the methodology. It is a cross-sectional study whereby it is done quantitatively. So it is a correlational research design whereby we recruited 203 undergraduate students with a confidence interval of 95% with a margin error of 5%. All of them must be Malaysian. And they study in a private or public university in Malaysia, and currently they must be in Malaysia. Experience at that time of the study, they must experience the MCO condition. This is a snowball sampling method. So the procedure is that the researcher team sends message through WhatsApp, Telegram, and WeChat application, and that's how we are able to get participants to participate in the study. So through these text messages, there are links to access to the online questionnaire, and the duration for the entire research data collection is about 3 months. So this online questionnaire is available for 3 months, and the participant is free to fill up the Google form, which is less than 15 minutes. The instrument used are International Physical Activity Questionnaire, the IPAC, short form, as well as General Health Questionnaire, GHQ-12. So based on the study, the results was obtained, and the demographic characteristics are indicated here. So for female, there was 126 of them, and male, there's 77 of them. And the average age range is 21 years old. Ethnicity-wise, 23 of them are Malay, 168 of them are Chinese, 19 of them are Indian, and 2 are other ethnicity. The result found that there was a significant reduction in terms of anxiety and depressive symptoms after they increased their physical activity. So it was a very weak correlation as indicated here. It's 0.192. So it is consistent with past research whereby it was indicated that behavior activation and physical activity is able to improve depression and anxiety symptoms, and it could potentially increase the overall emotional condition of the person, and therefore hypothesis is supported. More anxious and depressive the undergraduates are, the less energy expenditure of physical activity they will consume, thereby can be related to the COVID-19 pandemic situation and lifestyle changes. So one of the conditions could be because they have less energy to do other things, therefore they attributed a lot of energy on physical activity, and hence it can potentially lead to reduction in terms of their emotions because of this, because they are not focusing on other activities due to the limitations in terms of the quarantine and lockdown situation. Implementation of behavior activation, therefore, is suggested to be continued, especially for psychologists and for mental health professions, because it has been found to be effective. Therefore, if there is a mild condition, probably they can suggest this technique to help to reduce the anxiety and depressive symptoms for their clients or patients. Encouragement to continue exercising during quarantine times needs to be continued, as we know it's been 1 year and 2 years past plus already. The pandemic is still with us, so it's very highly encouraged that exercises can help to improve our mental health condition, especially for students who undergo so many difficulties, coping through online classes and so on. Educational institutions can also encourage this during their orientation, or maybe some sort of a workshop that they conduct with the students. These are the limitations, recommendations, and conclusion of the study. So the limitations are the study, as you saw, it was overpopulated with females mainly, and the questionnaires are self-reported, and it can create socially desirable responses. This study did not measure the severity of the depression and anxiety. We can only conclude that it can help with depression and anxiety symptoms, but we are not able to conclude whether this physical activity can help with severe depression and anxiety conditions. Recommendation is that the impact of types of physical activity on mental health must be studied in terms of what type of exact physical activity that is very beneficial for improving mental health and possibly depression and anxiety as well. Would it be jogging? Would it be weightlifting? Would it be the HIIT training? As well as qualitative research is very beneficial to further understand the depth in terms of the mechanism and the efficacy of physical activity. So the conclusion is that physical exercises in general can help with alleviating depressive and anxiety symptoms among undergraduate university students. Thank you very much for listening to my presentation. That's all for my presentation. Thank you.